I'm Ezriel Kornel. I'm a neurosurgeon at Northern Westchester Hospital. I'm the former chief of the Department of Neurosurgery, and I'm currently a director at large of the Orthopedic and Spine Institute. I specialize in minimally invasive neurosurgery of the spine and the brain. I have a particular interest in the neck or cervical spine. Patients come to me with complaints of neck pain and often pain radiating into the shoulder, down the arm, numbness, tingling in the arm, often weakness in the arm, and sometimes when the disc is compressing the spinal cord, also weakness in their legs. When there is weakness in the legs, then that becomes a very urgent matter requiring relief of pressure on the spinal cord. We're looking here at the neck or cervical spine. The front of the spine is made up of the vertebral bodies and the discs that sit in between them and cushion the vertebral bodies. When a disc fragment pushes on the nerve, we get pain into the arm and weakness and numbness. If we have to remove a disc, we come through the front, we make a very small incision along a skin crease in the neck and use a high-power microscope to expose the disc itself. Once we see the disc, we're able to remove it through a variety of techniques. And then we either put in a cage through which your own bone will grow and fuse the two vertebrae together, and that cage is held in place by either a plate and screws or plates that drive into the bone. The other option, and one that I like to use often, is to put an artificial disc in place of this disc, and that artificial disc allows movement. That movement then takes stresses off the adjacent discs and makes it less likely that these adjacent discs will deteriorate over time. Once we have completed the surgery, we simply close the skin incision, and more often than not, patients go home the same day. Though many patients do go home the same day that they've had the surgery, there are also many patients who have complex spine surgery or brain surgery who stay in the hospital for 1 to several days. When my patients are being treated at Northern Westchester Hospital, they realize that everyone from the nurses to the orderlies, to the physical therapists, to the dietary people, to the physicians, treat them with the full attention and care that they deserve.